I don't see Bill Flynn here anymore, so I can safely say that he stole some of my thunder on my slides, because you'll see a few.
But now you're free to do whatever you want to do.
Right, that's true. Anyway, there'll be a few that are similar to ones that he presented earlier, so I'll try to maybe go quickly through those. So basically, this is the outline, just give a little background, and go into why, from the FDA perspective, of course, why we need to collect data, what data we have, what data do we think are needed, and how will we use it. So as background, as Bill Flynn mentioned earlier, FDA CBN published the 5-year plan for supporting antimicrobial stewardship in veterinary settings just a few months ago. And he listed the 3 primary goals. I'm not going to repeat them, but just draw your attention to the last one, which is what this talk is going to be primarily about, enhancing the monitoring of antimicrobial resistance and antimicrobial drug use in animals. The overarching goal of FDA's ongoing efforts to support stewardship in these settings is to implement measures that address the public health concern of antimicrobial resistance, at the same time ensuring that animal health needs are met. So as you heard Dr. Flynn discuss earlier with GFI 209 and 213, as of January 1st of 2017, all medically important antimicrobials for use in feed or water require veterinary oversight, and growth promotion uses are no longer legal. So going on to, well, why do we need to collect data? And when I say we, I'm primarily referring to FDA, but it does kind of cut across some boundaries too. So we think that data, various types of data, is needed to, 1, assess the adoption of the changes that were outlined in GFI 213 that brought about those changes that were on the last slide. We also think that we need data to help us gauge the success of some of the antimicrobial stewardship efforts that FDA is supporting, but also that are going on within the community. Also, we think that data could help us better assess potential associations between antimicrobial use practices and resistance. So what data are needed? This is not an exhaustive list by any means, but it's a few things that I'll touch on today. Some of these items we actually have some of the data for, and some we don't. Some we're getting there. So we'll start with antimicrobial sales for food-producing animals. As most of you probably know, under law, Section 105 of the Animal Drug User Fee Amendments of 2008, the drug sponsors have to submit information on the amount of sales and distribution of antimicrobial drugs for food-producing animals, and then FDA has to turn around and publish a summary of that information, which is usually put out by the end of each calendar year. So there will be one coming up soon. And just in addition to that, as of 2016, the sponsors are to include a breakdown of estimated sales by species of the 4 major food-producing species, and I do put stress on the word estimated sales there. So when we talk about why collect antimicrobial sales, the main utility, or maybe even the only utility, is that they provide an indicator of the overall quantity of antimicrobials entering distribution channels. By no means do they provide information about how they're used, in what context, under what conditions, doses, durations. So outside of species, since we have that new requirement for the estimated species, we really don't get any additional information from just looking at sales. Information that is more important would be, actual use information, which we'll get to. So here we go. Because of the limitations that we know are in existence with the sales data, FDA firmly believes that on-farm antimicrobial use data is more important in assessing antimicrobial stewardship. And so the utility, again, this type of data can help us evaluate the actual context or conditions of antimicrobial use, kind of give us a clue of what disease challenges are present or increasing or decreasing, so what the antimicrobials were indicated for, as well as dose, duration, and whether or not they were even effective. So all of that information, is potentially obtainable if we are able to get antimicrobial use data. So, and it also does give us an opportunity, a potential opportunity to evaluate possible relationships between use and resistance. So the limitations, someone else earlier mentioned that it's very resource intensive to collect nationally representative data of antimicrobial use and long-term data. It takes a lot of time and money and just resources in general to have some sort of long-standing or sustainable plan. So that's something that we think about. Also, in terms of just limitations in that type of data, there are certainly differences in the detail in farm-level records. So we have not seen any one uniform system for capturing this type of data. There are some systems, it seems like, that were presented earlier that have worked on that and been successful with that. But across the board, it seems like there's all over the place type level of records. So I'm actually not going to go over this because Dr. Flynn pretty much described the cooperative agreements that we have in place. I guess one thing, just two things to point out here though. The projects were to be able to fulfill these things that I have listed. So the second one down was that we want them to be able to provide baseline data for the on-farm antimicrobial use, so data prior to GFI 213. So we're looking for a way to look at, a way to assess potentially any changes that have come about after the implementation of GFI 213. And then also the last point on there I think is really important, just incorporating, we asked them to incorporate strategies for protecting farm and producer identity and other confidential information. We don't want to see names or farm names or addresses or anything. We are interested in, the data that is being produced, that they can collect, but we're not interested really in that type of very level to the name or farm. So I just wanted to point that out too. Just to mention a few other on-farm antimicrobial use data collection efforts. Dr. Fossler earlier mentioned the antimicrobial use surveys that USDA is involved in. There are the NOM studies, which he also mentioned, and some of those do contain historical antimicrobial use information. And there may still be on the table some proposed longitudinal studies where they were going to try to follow use and resistance over time. So I'm not sure where those stand at the moment, but at one point they were in the planning stages. I just threw this up here. This probably doesn't fulfill your request, but this is a list of just antimicrobial use measures, really just examples of things or values that could be considered as numerators in some cases or as denominators in other cases. but my point being was that there are so many, and Dr. Hope earlier pointed out, even down to the level of the DDD vet and the UDD and the UCD. So a lot of different indices are kind of being proposed, and I think that what metric, well, first of all, there's probably no one perfect metric, to fit every situation. So kind of like no one size fits all. But it really probably depends on what the objective of your analysis is as to which metric you might pick. So if you're going to use total animals treated or total animals at risk of being treated. So it really depends on what you want to look at, and then there are a variety of things that can be calculated. But I'm not really a big proponent of just saying milligram per kilogram or whatever, and that's the only metric you can use, because there are a variety of ways that you can look at it. And it's been difficult to come to agreement also, just from experience with groups, just trying to figure out what the perfect one is, and maybe there just isn't a perfect one. We also do have, to some degree, antimicrobial resistance data through the NARMS program, as you can see here. They track changes in antimicrobial susceptibility of enteric bacteria in ill people, retail meats, and food animals. And someone mentioned earlier the interactive data displays are pretty impressive if you go on the website and look around. And they are also kind of expanding their sampling programs to some different types of samples, as well as into more states and stuff like that too. A couple limitations, or maybe gaps might be a better word, for antimicrobial resistance data are that resistance data for animal pathogens is not as available. Now, there are some programs such as FDA VetLearn and USDA's NULL program, though I believe they have some pilot programs looking at animal pathogens and antimicrobial resistance, so we would look forward to seeing those results. And then also, when we have resistance data for humans, we don't always have that link back to the antimicrobial use in animals. So that linkage is really hard to prove, I guess. There's some instances where looking at outbreak strains, etc., but it's hard to make the link all the time. And then also, animal health and demographics are important when we're talking about antimicrobial use, because it helps provide the context for assessing use information. In other words, are there diseases or disasters, for that matter, that affected antimicrobial use in animals that could explain why sales or use went up or down, that type of thing. Some data on that type of data is somewhat limited. Through the NOMS surveys, some of that information is provided. A lot of times that might just be for the reportable diseases. So for just kind of your standard animal diseases, it's kind of hard to really look for data prevalence in the US for some diseases, published data. So how will data be used? As you probably figured out, quantities alone don't demonstrate stewardship. There has to be some context put to that. So the context, again, goes back to, what environment were the animals in? What disease challenges were they faced with? What doses were used? What durations? All sorts of things that help tell us if antimicrobials are being used judiciously. But we do need evidence to demonstrate progress in antimicrobial stewardship in veterinary settings and be able to tell a story. We do at FDA get pressure from other organizations to, provide, updates or, Government Accountability Office. We're constantly, bombarded with questions about things like this. So it really is important for us to be able to provide accurate information when those requests for information come in. Again, Dr. Flynn already mentioned that we are planning to publish a comprehensive report that will include this type of information. And let's see, some of the challenges that kind of ongoing. A lot of you have probably seen misuse of antimicrobial sales and/or use data. Some articles might try to compare sales to use. They're very different measurements, and they're measuring different things, obviously. As we've talked about earlier in the conference, just how to best communicate progress. Should FDA be the one to communicate progress? Should it be a group effort? Those questions come to mind. Collaborative efforts of multiple stakeholders are crucial. We have a lot of collaborative efforts already going on. Accurate and reliable data is critical, as is confidentiality for those who participate in providing data. And that is something that's really important to us to get across, that we, again, are not interested in, farm level data that gives us names and addresses and stuff like that. We're more interested in national trends that demonstrate, how antibiotics are being used and how that might be changing over time. And this next question, though, is on our minds a lot. Beyond the cooperative agreements that are piloting methodologies, how do we create long-term and sustainable systems for antimicrobial use data collection? And then just the challenges of actually relating use and resistance. I just wanted to throw this in here, monitoring progress, to show that we at FDA have always kind of been focused on, rather than reducing use, we would say minimizing use / need, so minimizing the need for antimicrobials and optimizing how they are used when they are used. So we really are not in the game for saying we need to reduce the use of antimicrobials by 25%. We have no interest in doing that. We really are more interested in optimal use and protecting animal health while protecting human health at the same time. So this is the summary, just that data from multiple sources are needed. The data will support the continued availability of safe and effective antimicrobials for use in treating animals and humans. And then, of course, the ultimate goal would be to reduce the development of resistance while assuring that animal health needs are met.